Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we will review and provide commentary on resources, literature, and discussed issues related to the field of speech-language pathology.
You can use this podcast for ASHA professional development. For more information about us and certification maintenance hours, go to our website, www.slpnerdcast.com. SLP Nerdcast is brought to you in part by listeners like you. You can support our work by going to our website or social media pages and contributing. You can also find permanent products, notes, and other handouts, including a handout for this episode. Some items are free, others are not, but everything is always affordable. Visit our website, www.slpnerdcast.com, to submit a call for papers to come on the show and present with us. Contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to learn what you have to teach us.
Just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts, and its guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and fair representation of each topic that we tackle. That being said, it is always likely that there is an article we've missed or another perspective that isn't shared. If you have something to add to the conversation, please email us. We would love to hear from you.
Before we get started in today's episodes, financial and non-financial disclosures, I am the owner and founder of Grand Bois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. Amy Wonka is an employee of a public school system and co-founder of SLP Nerdcast. We're both members of ASHA SIG 12 and both serve on the AAC Advisory Group for Massachusetts Advocates for Children. I am a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, the Association for Behavior Analysis International, and the corresponding Speech-Language Pathology and Applied Behavior Analysis Special Interest Group. Welcome to our first episode of SLP Nerdcast. I'm Kate Grandbois.
I'm Amy Wonka.
And today we are talking about collaboration with BCBAs. Amy, why did we choose this topic?
Because you are a BCBA.
It's true.
It's true. Because we've personally learned a lot through collaborating with BCBAs.
True. Because almost every SLP is going to end up working with a BCBA at some point in their careers.
Fair point. Also, sometimes they make us grouchy.
It's the unspoken truth, isn't
Yeah.
it? It is. That sometimes SLPs and BCBAs do not see eye to eye.
Yeah. It's hard to get along.
It is. But we are going to try and explore that a little bit today. The content of our episode is going to be some background information about collaboration, background information about ABA, and then finally some, I guess you could call them tips and tricks for how to collaborate effectively with, we won't say the enemy, we will say the frenemy or the other colleague and collaborator.
The friend we haven't met yet.
Yes, the BCBA friend that we haven't met yet. I love that. Okay, so I guess moving on, Amy, why don't you tell us a little bit about why collaboration is so important?
Well, I think we all know that collaboration is important, and regardless of where you work, as a speech-language pathologist, you need to work with other people. If that's in the medical setting, you're working with a bunch of allied health professionals. If you're in the public schools, you're working with teachers and other therapists. If you're outpatient, you're working with a bunch of different professionals as well. So it's an important part of the job. Being able to work effectively with other people can be easy and wonderful. It can also be challenging and frustrating.
That's true.
Yeah.
I think every single clinical professional out there has had at least one argument, disagreement, professional disagreement, probably especially with this profession.
I think that that's fair to say.
It's a fair point.
When it's easy, it's clear that working together is the best option, right? We learn about the other person's discipline. We learn about how it affects our work with our client, how we can carry over their goals, how they might be able to carry over our goals. Co-treatment. Shucks. I'm trying really hard. This is
We don't curse in this podcast.
No. This is good, clean fun.
Good, clean SLP fun.
That's right.
Mm-hmm.
Co-treats.
As you were saying, Brainiac.
Yes.
Continue.
Co-treats are great. I have had some of my, some really great clinical experiences working collaboratively in the same session with an occupational therapist or a physical therapist. I feel like I've learned a lot. We've been able to maximize, the positioning and location of the client in space. That helps with communication. Also, their activities can be more fun than ours.
OTs have all the fun.
They have a lot of PTs have lots of fun.
Every
too.
single client I've ever shared, they hate coming to speech and they love going to OT.
Yeah, we may be picked wrong.
If there's any OTs out there,
Yeah.
we have jealous feelings
Yeah.
about your swings and your putty. I do love OTs.
I do too. So that's our love fest for other therapists. But how about when it's bad, right? When it doesn't work?
Which happens.
It does happen. And that's not something that's unique to BCBAs.
No.
That can happen in general. But when it doesn't just naturally happen and it's not magic and a love fest, I think it's helpful to remember that our code of ethics has a lot of components in there that talk about the necessity of collaboration. So if you read Principle 1, Section B of the ASHA Code of Ethics, you'll see it says, individuals shall use every resource, including referral and or interprofessional collaboration when appropriate, to ensure that quality service is provided. So Principle 1, that's the part that talks about holding paramount the welfare of the people that we serve professionally. Right. Sometimes we want to pack up our toys. We want to leave the sandbox and say, meh. But that really isn't in the best interest of our clients, patients, students, whatever word you use.
Well, I think especially when you consider the majority of people that we serve, well, maybe not the majority, but a high percentage of people that we serve are also seeing other professionals. Thinking about complex learners, individuals with autism, individuals with complex bodies. They almost always have a team of people. At least in my clinical experience, there are very few clients I've seen who just have one communication issue.
So I feel like what you're saying is that as speech pathologists, we should figure out how to collaborate with other people.
Yes, and I think based on our code of ethics, we sort of have to.
That is what it seems like. There's a whole nother principle, Principle 4. That's about upholding the dignity and autonomy of the profession, maintaining collaborative and harmonious inter- and intra-professional relationships, and accepting the self-imposed standards in our field. So that's also another...
That was a really long sentence.
That was a long sentence.
What's the difference between inter and intra-professional?
Oh my gosh, I'm so glad you asked. So interprofessional talks about within your own profession, so among other speech pathologists.
Okay,
Intra is across other professions.
Okay. So, I should probably have known that, but I didn't.
No, it's a good question.
Because I don't know everything, but I'm collaborating with you to learn.
Look at us, collaborating together. Okay. And we actually are inter and intra.
I guess
because
that's
not
true.
only are you a speech pathologist, you're a BCBA.
That is also true.
Wow.
Yeah.
Fancy stuff.
Mm-hmm.
Really, I think you can make the case for collaboration weaving its way through a lot of other areas of our code of ethics as well. So, if we look at Principle 2, that's looking at the need to achieve and maintain the highest level of professional competence and performance. So, if your job puts you in a situation where collaboration with ABA providers is part of the deal, some professional development in that area is sort of necessary. You need to know enough to be able to work effectively with these different people.
And if you don't know enough, you have to have the wherewithal to know what you don't know, which sounds like a repetitive, ridiculous statement, but that is a cornerstone of professional maturity and one of the biggest pieces in learning, in continuing education, is seeking out information and acknowledging that you don't know everything.
Yeah, I think you make a good point.
Yep. So I think we've both been really fortunate to have a bulk of good experiences with BCBAs.
Oh, yeah.
But we've also had a lot of frustrating ones.
I would say that in my experience, the scales are firmly tipped in the positive, but I know that that's not the case for everybody else. I have BCBAs who I consider near and dear friends. I think I've learned a lot of really great things, and I'll talk more about that later, when we're chatting. But, it's not always roses.
It's not. And I think this is probably a good segue into our next section related to a history of ABA. My personal, not a history of ABA, but an overview of ABA. My personal transition into the world of ABA was because I had so many frustrating experiences that I was motivated to go back and sit for the exam as a way of infiltrating the enemy camp and dismantling it from the inside.
Yes.
Because I had so many frustrating conversations, everything related to teaching language in discrete trial format exclusively, to using vocabulary that I didn't quite understand, like manned and tact. And I'm here to tell you that having gone through the education that a BCBA gets and being certified, ABA has a lot to offer. It is not all terrible. And I think they just have a pretty bad PR problem. And the more you learn about it, the more you realize that there's a lot that it can bring to the table.
I agree. I mean, as somebody who, for you listeners out there, Kate and I actually did that course sequence together.
Yes, I made her do it.
It was good. It was good. I mean, I love learning things.
It wasn't a hard ask.
No.
She was like, wait, go to school for 2 more years for no reason? Yes, please.
Sounds great. I opted not to sit for the exam for a number of reasons, but I think, even as somebody who chose not to go through the final process to actually become a BCBA, I took a lot away from that experience. I've worked in a lot of ABA-based settings, and I've learned a lot. It's made me a better speech-language pathologist. There's no doubt about it. So while there are frustrating parts, I think on the whole, there are a lot of wonderful, wonderful things.
Yes, which is, again, great segue. So let's try and unpack a little bit about what ABA is, so that we can then talk about how best to integrate it into our collaborative practices. So first of all, I think we need to acknowledge that, as we've mentioned, sometimes ABA has a bad reputation. But there are things that we can do to look past the bad experiences and embrace some of the good qualities. According to a great resource, if you want to learn more about ABA, it's a book written by Cooper, Heron, and Heward. According to those authors, ABA is, and this is a quote from page 15, ABA is a scientific approach for discovering environmental variables that reliably influence socially significant behavior. And I think some of the key takeaways from that quote are that it's a science, and that it is a science applied to influencing socially significant behavior. So these are behaviors that are very important to the individual, have and a significance in terms of improving their quality of life.
Also for society in general, right?
Yes.
Yeah.
Yes, absolutely. I think that, ABA is often associated with autism, far too often, but the principles of ABA are applied to dieting. They are applied to
exercise,
making me
exercise.
exercise. They're applied to quitting smoking, drug addiction. And I say this a lot when I'm working with families. If I got paid in rainbows and smiles, I would probably not keep going to my job. So there are principles of ABA at work everywhere. ABA uses what's called the operant model, which is learning. It's the concept that learning is the result of consequences that follow a behavior, and that those consequences determine the likelihood that a behavior will occur again in the future. That's a reference to an article by Donaldson and Stamer in 2014, which is a great article that we will have posted on the website.
And I was just going to say, if you want to read more about these articles, check out our website.
Yes, we will have a list of all of these references and resources on the website. So that's a little bit about what ABA is, but I think it's also important to acknowledge what ABA is not. So ABA often gets misinterpreted as being only discrete trial training, and I think most of us have seen what discrete trial looks like, particularly when teaching language. It's a field of 3, and the student or client or individual is being asked to engage in a really specific response 10 times in a row, and then they get a cookie or a gummy bear. I feel like that's like the classic model what you see in like a school or a clinic.
Yeah, and I feel like I've heard that referred to as mass trials, right? You're doing the same thing over and over and over again.
Or drilling, doing drills, language drills. I mean, I think ABA is also misinterpreted as teaching rote communication or memorization, which it does that happens sometimes, but that's not what ABA is in general. ABA is not necessarily teaching at the table. ABA is not only for autism, as we've already reviewed. There is literature for the positive impacts of ABA across general education, stroke, dementia, health and fitness, public health, environment and sustainability, addiction. It's even used in the business world, which is really interesting. ABA is not a curriculum, and my favorite, ABA is not bribery or manipulation. I think those are casual terms that we use in terms of less structured settings like parenting. So, I bribed my kids with a piece of chocolate or what have you. ABA is not any of those things. ABA is a science, and it can be provided in naturalistic settings. There are a lot of resources if you would like to learn more about ABA, and we are definitely going to have some of these listed on our website. The two, one that I already mentioned is the book Applied Behavior Analysis by Cooper, Heron, and Heward. A lot of the people in the ABA world very casually referred to that as the White Bible, which it is not a religious text, but I think in terms of it as a good comparison, it's very much like the Language Disorders book by Rhea Paul in the speech world, which I feel like most speech pathologists know what the Rhea Paul book is.
I still have the Rhea Paul book.
Yeah, I love my Rhea Paul book.
Yeah.
It's my purple Bible.
Yes.
See?
Yeah.
So
it's a good book.
The Applied Behavior Analysis by Cooper, Heron, and Heward is a really wonderful reference if you'd like to learn more about ABA. The BACB website is another great resource. The BACB is basically ASHA for ABA. It stands for Behavior Analyst Certification Board, and they have a lot of resources on their website.
I also like the VB Map, which is actually an assessment tool, but the guide that comes with that assessment tool contains so much information about the behavioral interpretation of different functions of language. I find it really concise and easily readable.
Yes, I'm not as familiar with that, which is probably something I should be embarrassed about. But I've not used that tool as much as I should have. But everybody doesn't know everything. That's totally cool.
Can't read every book. That's why we're here.
You can't. That's exactly right. So in terms of thinking about what ABA can bring to the table, BCBAs look at this same problem from a different angle. So often when we are meeting with a client, we're looking at vocabulary or syntax or quality of communication. And BCBAs don't necessarily have that educational background in terms of developmental linguistics.
I'd say they typically don't.
Yes, they typically don't. However, they do focus quite a bit on the function of language, which when I went through I'm sure when we both went through our BCBA training, I think we found to be pretty interesting. So instead of thinking about why are you using the word cookie, or should we talk about graham cracker versus cookie versus Toll House, what vocabulary word are you using? The BCBA is looking at what reinforcer is in place that is motivating the individual to use that word in general. So it's more about the interaction between the use of language and its impact on the environment, and what consequences follow that make that communication exchange happen. There is BCBAs get a lot of education in measurement and how to measure these kinds of things, which is something that I think is very contributing factor in terms of what they help me out here.
Oh, I feel like the data collection piece, that was my jam, right? I love data. And so for me, that's one of the pieces where I've connected with the BCBAs in my life, is the ability to manipulate and consider different ways to solve the problem of the clinical question that you're posing at that time, right? So what is a way to collect data that's unobtrusive and gives me the actual answer that I want and doesn't take away from the therapeutic integrity of, the interaction I'm having with a client? That's, your BCBAs can really help you out a lot there. I feel like, I'm like medium old, but when I went to grad school, there was, there was a lot of emphasis on, kind of trial by trial data, and, 80% became the criteria for a lot of goals and objectives. That's not always the best way to think about it. And that doesn't always get at the skill that we actually want our clients to achieve. Mm-hmm. And so I think that the different ways that BCBAs are able to look at and consider collection and analysis of data really help all allied health practitioners practice.
I think it's a really nice way to bring a BCBA into the conversation, if you're especially if you're having a disagreement, is to talk about their skills and how to measure certain behaviors. To be honest, they get a much better education in this than speech pathologists do. It's much more detailed, wouldn't you agree?
Yeah, I mean, if I had to like be a bit crass about it and break it down, I would say that speech language pathologists get a lot of information about content. We are content experts. We're not experts, we're experts. And when you think about BCBAs, I feel like they get a lot of education around application, right? So they can help us take the information that we know and apply it in a way that lets our client be successful in acquiring the skills that we want them to have. Where they fall short, typically, in my estimation, is around that content. So I think, when we have successful collaboration, it really is the best of both worlds for the people who we're supporting.
Definitely. And I think when you do end up bringing those qualities into the fold in terms of looking at function, looking at how better you can measure an individual's communication, you are meeting those ethical standards, you're holding the needs of the student or client most paramount, and you're improving services across the board. And that's not just for the client or student, that's also for the family. So keeping in mind, particularly for our students with autism, or clients with autism, a lot of these individuals are getting 30, 40 hours of ABA a week.
Right.
And how confusing is that if your speech pathologist is saying, work on core vocabulary, and your behavior analyst is saying, no, mand. That is incredibly disjointed in terms of a collective treatment package. So when you're bringing the BCBA in and collaborating with them effectively, not only are you improving services for the client, but you're really helping to ease that burden for the entire family. Not to mention the sheer number of hours and the way that BCBAs bill. So speech pathologists, we typically do, if you're in a school, a handful of 30-minute sessions based on the documentation in the IEP. Maybe if you're in private practice, you're getting 30-minute, 45-minute, 1-hour session a week. And the BCBA is outnumbering you in terms of the number of hours that the student is getting. They're getting 30 to 40 hours. So if you can make that collaboration happen, you have this wealth of time where you can get your student or client to be practicing some of the skills that you want to be practicing.
And I would say in most of my experience, it's not the BCBA who's providing that like large aggregate number of hours. It's a paraprofessional level staff. But the difference between, the speech language pathologist and the BCBA would be that the BCBA is actually able to bill for those indirect hours of providing supervision to that staff, whereas we're
more
not.
Jealous feelings.
I know. Big jealous feelings.
If anybody's listening out there who feels like taking on an advocacy project, we need more boots on the ground to advocate for a different billing structure.
For sure.
That's a separate podcast, maybe.
It is a different podcast, yeah. But if you can get in with the BCBA and you guys are aligned and you're on the same page, that's one more person who's making sure that the paraprofessional staff who's working with your client is also following through, with your goals and your recommendations. So, another big piece is that often, the BCBA is in the home. I know, Kate, you're in private practice, so you might have the opportunity to be in the homes more than, those of us who are in outpatient or schools. But if you have a BCBA who's going into the home, being connected with them is going to help, your client generalize those skills across environments.
Huge.
And they can bring back new information for you too about, maybe this thing is meaningful in terms of, connection to the 3rd grade curriculum, but there's this other piece at home that would also be super meaningful for this client and their family. So, the BCBA can really be a very helpful liaison as well.
I agree. And that sort of brings us to another point. The correlation between individuals who have a communication disorder and a behavioral issue is really high. I can't tell you, I'm having coffee with a fellow colleague of ours next week because in her private practice, her clinicians are having a really hard time just getting her clients to crawl out from under the table. There are so many refusal behaviors or non-compliant behaviors because for so many of our, pediatric clients, they develop unwanted or maladaptive behaviors in place of communication because communication is so hard. So there are probably millions of instances out there where the client you're working with also has behavioral needs.
Well, And this is where, I think back, I'm sure everybody who's listening, who's a bit longer in the tooth can think back to like...
Long in the tooth.
Long in the tooth.
Does that mean old?
Yes. It's a
Learning something new every day.
It's a folksy horse saying. So, you can think back to when you were first out of grad school and you look back on things and you're like, oh my gosh, I can't believe I did that. I can't believe I did
horrifying.
That. Right. So I think behaviorally that's true for me as well. I definitely, to use the terminology from ABA, I reinforced problem behaviors completely inadvertently because I didn't realize, right? So, a good example is I have a client and they're in on the swing and we're like, pushing on the swing and they get upset and I can tell that they're upset and maybe they hit me because they're feeling so upset and I can tell like you're upset because you want more swinging. So what I do is I maybe model more swing and then I push them on the swing. What my behavioral colleague might say is like, silly McGilly, you just
gave them more swing for hitting you, right?
Right, so you just made it more likely that in the future, because back to what Kate was saying earlier, when you look in the behavioral paradigm, you're thinking that what happens after a behavior makes it more or less likely that it will happen in the future. So when, I think back to that moment where, I pushed the client on the swing because they hit me, because I knew what they wanted, I just made it more likely because that was what they wanted. But if I were working in concert with a BCBA or somebody else, who had that behavioral background, and even having that knowledge now, I would do that differently. So I think, there are behavioral challenges where it impacts your effectiveness as a therapist, but also like, just like other people may undo what we want to do, we could be undoing their things inadvertently.
Totally by accident.
Yeah.
And I think, there are the spectrum of problem behaviors is so wide. So there are problem behaviors that are, I guess we'll say mild.
Yep.
They're not dangerous. They're not negatively impacting the individual or the family quality of life to a significant degree. If anybody has any toddlers, we know what that looks like, typically developing toddlers. But, in terms of the spectrum of special education, at least in pediatrics, there are more severe problem behaviors. And this is my personal clinical area. When you have an individual who's engaging in significant problem behavior that is unsafe or that is, dangerous to other individuals or themselves, there is a time where you may need to take a back seat and as a speech pathologist, and that can be really tricky. I've had a handful of instances in my career where I've been asked by the parent or someone else in the school to come in and, facilitate, try and make some recommendations for better language because they want the individual to be commenting or they want them to be using core vocabulary. And I arrive and the individual is head hitting at such high rates that they've given themselves concussions and they're breaking their facial bones. And, there are extreme situations out there where, yes, I would love that individual. I would love to be able to teach that individual to make comments and to use core vocabulary. However, I have enough wherewithal to say, okay, but that's not the most important thing for that individual from a safety standpoint. And being able to acknowledge that and sort of support the behavioral team as a primary person for intervention, because that's what's most important for that. I mean, I know that's like the more extreme side of things, but there are times where behavioral needs supersede communication needs.
Well, and I know the focus of this podcast is BCBAs, but, thinking about our collaboration with occupational therapists also, I think we all, when you're regulated and when you're available for learning, you're available for learning. And that runs the gamut. That's true for, adults, that's true for young children. And so, in the case that you're describing, Kate, like that person's not available for learning.
Right.
So whether those are the ultimate goals or not, like first the team needs to work together to make sure they're at a place where they're in a place where they can learn. Like, none of us is doing our best work when we're at crisis level 20.
No.
It's just not compatible regardless of, your unique characteristics as an individual.
Right. And that's a byproduct of being human. I mean, I know my husband was recently in a meeting where he was so nervous that he lost his words because his anxiety was really high. He was working at a level 12, like you said. He was not available to perform his best work. And I think that relationship between emotion and communication is true for everyone to a certain degree. So now that we've sort of covered why we should collaborate with BCBAs, I think this would maybe be a good transition to talk about strategies for when that collaboration, when you as a professional have acknowledged that collaboration is important, that you see the players involved and that you're willing to collaborate, but either that person is a prickly pear or they're recommending things that you think are inappropriate, or maybe there's a third party like a teacher or a paraprofessional or parent who is making that collaboration more difficult.
Yeah. So, I mean, how do you make it work? I feel like for me, if I had to classify it, I would put it in like 3 big different buckets of barriers, right? So there are, logistical barriers. I feel like logistical barriers are real, even if, I know some of your terminology, and I'm on board, emotionally with trying to be flexible and like collaborative. If we don't have time, we don't have time. Like, effective collaboration takes time. No matter who you're collaborating with, no matter what the context is, like you need time. That's a real barrier.
And it varies by setting.
Mm-hmm, it does. And I feel like the solutions to that problem depend on the setting too. I mean, when you're outpatient, it's hard to make time for when I worked outpatient, most recently, I was per diem, I was at night. So I'm trying to collaborate with school providers, but I can't because I have a second job during the day.
Plus, they're not going to pay you for that.
They're not going to pay you for that.
That is not part of your productivity.
No. So it's really hard. So when you're in a productivity-driven model and perhaps you're working offset hours with the people who you're trying to collaborate with, what are your options? Like, I personally think face-to-face is best, especially if you're going to have a potential disagreement, because when you see someone's face, I'm looking at Kate's face. Would you see someone's face? It's harder to be really grouchy with them, right? But
if you want to be grouchy or you feel grouchy, it's so much easier to do that over email than it is to a person's face.
Correct. So, but let's say you can't do that, right? Because you work nights and the school people work days and nobody's paying you for it anyway, right? So, second, phone call. Can you coordinate a phone call? Do you have like a cusp hour where like you've just gotten to your second job and they're just wrapping up their job? Maybe you can call. That's better than emails, which are an option, and technology is great. But like, have you ever tried to navigate a frustrating experience over email? Dude,
it's the worst.
It's so bad. I just did that. I just got in a fight with my like health insurance company.
Do you write an angry email and then just let it sit in your draft
Yes.
box because you can't send it?
Yes, because I'm like, this is
Sometimes
harsh.
that's my only choice, because I have no other way to effectively dismantle the argument and use some of the other strategies that I have to be like, sometimes if you're having a prickly pear disagreement and you just smile.
Yeah.
Or you just say, hey, I like your pants.
Yeah.
You can diffuse a lot of the disagreement and just have a human moment, and you cannot do that over email.
No, emojis only go so far.
And they're cheesy. There's no place for those in a professional exchange sometimes.
No. So those, I think that those are real challenges. Those are real barriers. They're logistical. I think thinking about making connections with other people and kind of all the pieces that go into that, making it as in person as you can would be a tip. If you can't do it, be cognizant of the fact that emails don't carry tone and emotion as effectively as you'd like them to. So, then like having worked in schools, it's a little different. Like in private schools, I've worked in a couple of private schools. They tend to program that time into their day. Like it might be everybody comes in at 7:30 on Tuesdays.
You mean private schools for substantially separate
Correct.
special ed. So not necessarily private, like regular private, general education private schools.
Correct.
But private schools for a substantially separate, am I saying that right?
Yeah, substantially separate setting.
Yeah, substantially separate setting.
And a more restrictive setting.
And I also feel like, for Amy, you have done a really great job advocating with your administration to make sure that that they acknowledge that collaboration is important. I know ASHA has some literature on their website about embracing the 3-to-1 model. I don't know if you want to talk about that a little bit, because I feel like that has its place, especially if you're doing consult once a month or whatever.
So when you think about public schools, you're documenting your time, your consultation time in the IEP. I would definitely advocate for people to think about what amount of consultation they really need to be effective. thinking about the 3-1 model, ASHA has a lot of great resources about the workload approach to caseload, which I have found is difficult for public school administrators sometimes to wrap their heads around. The 3-1 model is a way to sort of encapsulate all of the indirect services that would be captured in a workload approach to caseload, in which 3 of the weeks within a month you're providing direct service. So that would be your B and C grid service for the IEP. And then in the 4th week, you're providing indirect service, and it's sort of set aside. You're designating that time in the A grid, the indirect service grid of the IEP, and you're making time for all of those services, which are really essential. And I think looking to ASHA, looking to their resources on workload approach to caseload is a really great tip. They have a lot of information there.
And even if you're not in the schools, if you are in an outpatient setting, advocating to your administration or to your supervisor, particularly if you're working with complex learners, individuals with autism, individuals with complex medical backgrounds, being able to set aside a certain amount of time to collaborate with their physician or their outpatient OT, or the home ABA service providers, being able to make sure that time is set aside for you can not necessarily increase your productivity from a monetary standpoint, but can do a lot of other really great stuff for your clinic.
And I don't see any reason why the workload information that's on the ASHA website couldn't be utilized to have a conversation with administrators in different employment settings as well.
Fair point. This is what best practice is.
Right.
And if you need to translate it to your administration for budgetary reasons, customer service.
Right.
Making sure that the families feel that you're putting in the extra time to help collaborate and integrate things across different settings.
Yeah.
For sure.
The next big barrier, so we've got our 3 buckets of barriers. Bucket number 1 is logistics. I would say the next big barrier would be knowledge base related. So, I'm not a BCBA, Kate's dual certified. We did both take the coursework, and
which we've now mentioned multiple
times. We took the classes. We learned things. I think when you make a commitment like that, it really helps you with your collaboration. I think it was very helpful for me to learn what their words mean, and now I can use those words in a conversation and feel pretty confident that I know what they're thinking when I use those words, and it allows me to redefine my terminology using their terminology. You don't have to make that commitment, but I think, thinking about doing a little reading so that you can use the same jargon. I do feel like professionals sometimes, like when we get our hackles up, we go all in with the jargon.
And I think that the ABA world in particular has so much jargon.
They love jargon.
Like, we have jargon, like most people don't know what a uvula is. But I would say the dangly thing in the back of your throat. I wouldn't say uvula because I know that the layperson does not know what that is. And for some reason, the ABA world, Skinner, he was a genius in so many ways. But when he made up all these words, he really sort of threw a wrench into things. And I think that, just to your point earlier about having your hackles up, when you have these difficult conversations or you have a BCBA you're working with that is a little bit of a prickly pear, it might be a great idea to ask them, so what do you mean when you say manned? If you don't have the resources or the time to go take a course or do flashcards or read verbal behavior, ask them. You can disarm their anger or defensiveness by trying to engage in a collaborative discussion so that you can learn, so that you can sort of say to them, I don't know everything. I'm hoping that we can collaborate so that I can learn something from you. And by doing that, you might be able to disarm them a little, not disarm them, but make the exchange a little bit more friendly instead of defensive.
Yes. And I mean, we could also be the prickly pear. Like, sometimes maybe I'm the prickly one in the conversation.
I don't know, I could be. You could be.
I could
but
be.
You're not.
No, I
you
could.
You disagree with a smile.
I could.
Always.
Right, except an email, and then I'm just a grouch.
And then you leave it in your draft box.
Right.
Like a rational, sane human being.
No, my poor health insurance lady got a real sassy email. But I think, thinking about, I work in my current role, I work with augmentative and alternative communication, and we talk a lot about using core vocabulary, so using high frequency vocabulary to define fringe vocabulary, so less frequently used and more specific terms. And I think, that's a helpful exercise too. What is a mand? How would you define it using core vocabulary?
And you think it's a request, but it's a very specific definition. It is not always a request.
No, and I think, an exercise like that is helpful because then we could together realize that, in speech language pathology, there are like 3 or 4 terms that a BCBA would consider a mand, right? So they would consider, reject,
Refusal.
protest, refusing, like all of these things that I would consider as differently classified functions. They all kind of group under this one term of mand. So going through that exercise can be helpful because then it also helps them have the perspective that we're thinking about it in all of these different ways. We mentioned earlier, I think the biggest benefit for me in collaborating with and learning about ABA has been the data collection piece. I mean, thinking about, is 80% really the criteria I want? Do I want this person to just increase their frequency of doing something? Do I want them to increase their independence and their frequency? Thinking about different ways to collect that data and the idea that maybe I don't need to write a million pluses and minuses on a Post-it note. I can just collect data on the first time you did it. And if you did it independently and accurately the first time we, looked at that page in the story, I can just be in the therapeutic moment with you, and I don't need to be half present because I've got to scratch all these things on a Post-it note.
And I think that the data collection piece is also a really great way to diffuse arguments. Mm-hmm. So how many times have, between the two of us, been in a situation with the BCBA where they think, nope, I don't think that this student should use touch chat. I don't think they should use LAMP. We're both AAC people. I think that they need to use Sign. I think they need to use PECS, or they have some other recommendation. And there's this big to-do over whose territory it is and who's making the right call. Mm-hmm. But you have to work with this person because the parents think that they're great, or because they're in the home, or because they work at your school. And mm-hmm. you have to work together as a team. And this is something that I've learned from you. Take the data. Do it. Just let the numbers speak for themselves. If you feel like you don't have it in your wheelhouse to design the data collection system, let the BCBA do it. Mm-hmm. Listen, BCBA, you are so super smart with all of this data collection system. Just tell me what kind of data to collect, and then I will take data on my tool, and then we'll take data on your tool, and we will see what happens. It's mm-hmm. a great way to flesh out an argument without making it a pissing contest.
It's also really good practice because one of the things that I love about data, and we've had a version of this conversation
multiple
a lot of times. But I feel like, data does take your kind of belief set out of it. There are times mm-hmm. when I've thought that something would be very effective, and then we collect the data and it wasn't. And so that's my job. That's what I want to know.
And what's great is that BCBAs are driven by data. So mm-hmm. if you're having that argument or discussion, then the numbers speak for themselves, and they sort of have to acquiesce,
right?
Depending on, how it flushes out.
Well, and then you were collaborating to solve the problem together instead of having a sassy battle, right?
I don't like sassy battles, but I like that phrase.
Yeah, right.
Sassy battle.
Sassy battles. Nobody wants one, but it's fun to say. Just like uvula. No, you do want a uvula, but it's also fun to say.
Does the uvula have a purpose? Should I know that?
Speech science people could tell us that.
If somebody wants to email us and tell us what the uvula does, that would be great.
Uvula would be helpful. It's bad.
Oh, the puns.
So, yeah.
They're so good.
So barriers. We've got logistical barrier. We have terminology and knowledge barrier. Our last barrier, I would say, would be kind of the social relational barrier.
Okay, that's fair.
And that's real, right? So you have the information. You allocated the time in your schedule, but you still it's not working. It's probably a social barrier. Collaborating with
meaning the person doesn't have great social skills?
No. I mean, I suppose that could be part of it, but more just
you don't like the person?
Sometimes you just don't really like people.
That's fair.
Right? That's real. I have a very socially focused job, and I like it to be real quiet and just me and my dog.
Do you have somebody that's giving you the creeps?
No, I feel like it's more just sometimes you meet people and you're we could be friends.
Yes.
Right?
And that's so much easier to collaborate and easier to disagree.
Yes.
when you're friends.
Correct.
I think more importantly.
Yes. We've had some good disagreements.
Yes, we disagree quite a bit.
Yeah.
That's why I was saying earlier that you argue with a smile. You disagree with a smile because you do it to me all the time.
That's true. We do fight. Yeah. So I feel like, you know, if you, like, you're not going to like everybody. Not everybody needs to be your friend.
And not everybody's going to like you.
No.
That's just life.
I know. And so, you know, you have to find a way as a professional to, like, work around that and be like, all right, I don't really like you. We will never go out after work together ever.
No. But I do feel like sometimes it helps to make an effort for social niceties. Like, and I keep saying I like your pants, but, you know, or not necessarily complimenting their aesthetic, but how was your weekend? Did you have a nice break? Just taking a moment to be a human, a moment to have a human connection, and not necessarily take a vested interest in their life, but find some sort of common ground to have a nice exchange outside of the topic that you're collaborating around.
So, like, be a person, not a jerk.
Be a person, don't be a jerk.
Yeah, don't be a jerk.
I think that's a great expression.
Yeah. So I think that there are two, back to these terms, like, there's an intra-professional challenge, right? So, and that's
you're coming full circle.
I know. It's like within yourself, right? So within myself, it's really an intrapersonal issue, right? Like, I'm making an active choice. I've identified I don't like Kate so much, right? But I know I have to.
That's so sad.
No, I love you. It's okay. But, like, we have to work together, right? So we have to work together. So, like, it's a challenge, a professional challenge within myself to, like, find a way to be kind to you and, like, cultivate kind of nicer thoughts toward you.
Right.
Recognizing that we might never be friends, but
I have to say, I feel like this interpersonal bucket, is a cornerstone for successful collaboration.
Yeah.
So even if you don't agree, just finding a way, finding the strength or emotional bandwidth within yourself to be kind, to be professional, to be human, and to not be a jerk, especially when the other person is maybe a jerk.
Well, and to, like, you know, like, use your perspective taking skills, right? I see sometimes what I'll see disagreements between, let's say, a veteran speech language pathologist and somebody who's new to the field as a behavior analyst. And I think, back to my example, like, I can look back on things that I did as a brand new speech pathologist when I, like, knew so many things, you know, like, I was
graduate,
confident.
you're like, I can do everything. I'm gonna change the world.
I had a lot of confidence. I had a lot of, like, grand views. And I think even just that piece of being able to, like, reflect back to maybe what that moment felt like for you as a professional, as a person, and see that maybe part of, like, when someone is coming on really strong, like, that's also probably coming from a place of, like, all of this passion and excitement for their field, you know. So trying to do a little bit of that perspective taking and thinking about, you know, maybe what it feels like is this person is being rigid and pushy and bossy, but perhaps the way that they're thinking about it is, like, they so much want to help this client and they really feel so passionately that, like, this is the best way to do it. And not that taking their perspective, like, changes everything, but I find for me it helps me cultivate kinder feelings, and that leaves me open to creating the structure where we can have a better relationship.
And I think that that's a really nice way to avoid being territorial, because if you approach any exchange, particularly one that might be contentious, with an ego, all bets are off. Nothing functional, nothing collaborative, nothing positive is going to come out of that exchange. And especially when you're working with BCBAs who, to be honest, feel that communication is within their scope of practice. You know, there is this debate about whether or not that's true, which is probably I'm looking at the time, that's probably a whole other podcast we could do.
Yeah.
But when you're working with a professional, you know, when you're collaborating with an OT, you're not entering the exchange thinking, oh, well, I know a lot about sensory integration, or I know a lot about fine motor skills.
Oh, but we fight about feeding all the time.
But feeding, okay, so perfect. So
Yeah.
feeding is maybe that one shared area. And the shared area with BCBAs, I feel like, is much larger and goes across feeding and AAC and language development and communication in general. So you're talking about an exchange that has a lot more potential to be explosive because you're sharing so many, or quote unquote sharing so many more areas of your scope of practice.
Well, and I think, you know, that gets at the second piece of that kind of interpersonal social component, which is, you know, the social aspect of the interprofessional relationship, which really is, that knowledge and vocabulary piece that, is a barrier for us in not knowing their jargon and not understanding their terminology. The BCBAs have that gap for us as well. So the social burden on us is to be able to cultivate a solid enough working relationship that we can provide that education, even if it's not necessarily something that BCBA would have sought out on their own. Mm-hmm. So kind of demonstrating, we did lots and lots of credits in school where we learned a lot about language. We learned a lot about phonetics, phonology. We can write in this magical language of IPA. We have all of these, components that they're not even aware potentially are information that we keep.
Right.
And so, by having an established relationship where you're able to share that in a way that doesn't feel like you're jamming it down their throat, but is also assertive. Collaboration is not just giving up and letting some other professional rule the roost. The other big piece of our code of ethics is we need to do what's best for our client. And if that means having a professional disagreement, that's what it means.
And it's okay to disagree. Mm-hmm. I think this is another thing that I've learned from you over the years is that disagreeing doesn't have to mean fighting.
Right.
Disagreeing can be a professional, hey man, it's cool. We can still be friends. We can still work in the same place. We can still have social niceties and not agree on this one thing. And that is okay.
So I had a boss a few years back who provided me with this very, very powerful phrase that I continue to use to this day, which is, we can agree to disagree.
Yeah.
And that's okay.
Yeah.
That's okay. It's sometimes...
Well, it feels uncomfortable. I feel like conflict is not something that we culturally embrace. And it's not something that people enjoy. It's not right. Something that's pleasant. So I think a lot of times it becomes contentious by accident just because that's the default. But it doesn't have to be that way.
No, and I find that to be, I use that phrase a lot. I've used it with
multiple times.
But, I think it's if you feel like the conversation is getting too heated, it's a good stopping point to just say, you know what, I think we're just going to agree to disagree on this, and that's okay.
And that's totally okay. And making sure that they know that that's okay. Mm-hmm. I also think that by doing that, you're modeling maturity. You're providing an opportunity for learning, for additional learning between yourself and the person that you're disagreeing with. You're modeling, you're providing an opportunity to show other SLPAs or other younger speech pathologists, or maybe not even younger, but greener speech pathologists, new graduates, on how to navigate some of these tricky waters. So I think it's a nice way to identify that as an area of professional development and go into the difficult conversation, knowing that you might just have to disagree.
There also, in the resources on our webpage, there is a link to a book called Difficult Conversations, which is also a very helpful text just about having difficult conversations with other people.
Yeah, difficult conversations are real. They happen. Okay, so I think that pretty much concludes the background information about ABA, and the strategies for how to collaborate. I guess in summary, collaboration is really important. It's part of our ethical code. Even though ABA may have a little bit of a PR issue and you may have had some difficult conversation or difficult experiences with BCBAs, ABA is not the devil's work. BCBAs have a lot to offer. The science of ABA is something that's pervasive everywhere. It is not related just to autism or discrete trial. And we definitely encourage you to have a little bit of an open mind in going into collaborating with BCBAs. And we, of course, are here to get feedback if there's an issue that you would like some guidance on or something else that you would like to talk about. Where can you guys find some more information? So as Amy mentioned, we have additional resources posted on our website. There is a great article that we referenced called Team Collaboration, the Use of Behavior Principles for Serving Students with ASD, which was published in Language, Speech, and Hearing Services in Schools. by Donaldson and Stamer. There's the Cooper Heron and Howard book, the BACB website, the ASHA Code of Ethics. And
you can look on ASHA. On ASHA, there's also going to be links on our website to their information about workload approach to caseload. And then the Difficult Conversations book by Stone, Patton, and Heen will also be listed on the website.
Excellent. And finally, if anybody out there is interested in becoming a BCBA, the BACB changed their rules for taking the 7-course sequence just this past year. So if anyone out there is interested in becoming a BCBA or has considered it, definitely reach out and send us an email. We would both love to talk more about it. I think while we have the same education, I sat for the exam, Amy didn't, but I think we can both agree that it added quite a bit to our clinical practices and was worthwhile.
Definitely.
For sure.
Definitely.
So in closing, just to review, this podcast can be used for continuing for certification maintenance hours. Just go to our website, www.slpnerdcast.com. Click on the episode and then click on Get CEUs. You will be guided to a quick 3-question post-test, and then we will email you a certificate of completion, attendance. Anything else?
No,
that's it.
Thanks for joining us.
Thank you so much for joining us. Stay tuned for our next episode on aided language stimulation. Very exciting. Well, thanks again, everybody, for joining us, and we will see you next time.